On fait un zoom.
Ah, c'était mieux. Ah, je sentais que ça allait.
Ouais, on sentait que
Ouais,
ça
c'était
allait.
bien.
Ouais.
Ouais.
Very insightful stuff. It looks simple, but very complex at the same time.
It does. Today, these therapies are indicated for patients who have already been through 2 unsuccessful standard treatments: chemotherapy, bone marrow transplant, or surgery. And you know, for many patients, this could be the last line of treatment. However, recently released data has shown efficacy of CAR T-cell therapy as a first line of treatment. And this is very encouraging, as it means that in the future, more patients could be treated earlier in the course of the disease, limiting the number of hospitalization and more lengthy treatment options.
Okay, so if I've understood correctly, one product is manufactured for one patient, is that correct?
This is correct. When one product is manufactured for one patient, this is called autologous therapy. The process to manufacture the treatment is using the cells of the patient. But research is also conducted for j'ai raté. Désolée. Ah oui, il faut tout recommencer du début.
C'est pas grave. T'inquiète pas.
Very insightful
Don't
stuff.
worry, don't worry.
Hop, hop. Allez,
Very insightful.
go.
Very insightful stuff. It looks simple, but very complex at the same time.
It does. Today, these therapies are indicated for patients who have already been through 2 unsuccessful standard treatment: chemotherapy, bone marrow transplant, or surgery. And you know, for many of these patients, this could be the last line of treatment. However, recently released data have shown efficacy of CAR T-cell therapy as a first line of treatment. And this is very encouraging, as it means that in the future, more patients could be treated earlier in the course of the disease, limiting the number of hospitalization and more lengthy treatment options.
Okay, so if I've understood correctly, one product is manufactured for one patient?
Yes, when one product is manufactured for one patient, this is called autologous therapy. The process to manufacture the treatment is using the cells of the patient. But research is also conducted for allogenic therapy. In this case, the cells are coming from a healthy donor, and they are used to manufacture several products for several patients. As you can imagine, both are linked to very complex processes with a lot of challenges, but they are also very, very promising. Today, the products available to patients are autologous, but allogenic products are in research are showing great potentials.
So I'd imagine from a therapeutic perspective, it will give hope to patients with very urgent medical needs.
It will, and some patient stories are just breathtaking. Emily Whitehead was the first pediatric patient enrolled in an experimental immunotherapy for advanced acute lymphoblastic leukemia, and since 2012, she's being diagnosed cancer-free. Her story is well known worldwide. It helped focus public attention on the potential for cancer immunotherapy to transform cancer treatment. So here's another short video, a personal and emotional story, but at the same time a great educational resource.
Dans la boîte.
C'est là.
Ça va être beaucoup plus naturel.
Ouais.
Ah, c'est chiant, là.
Ouais.
Number 3.
Yes.
Yeah.
Je parle pas hein, dans les troisième.
Si, tu parles.
Si, je parle dans
Ça
celle-ci.
dit à toi, là.
Felix, wake
Wake
up.
Je me souviens.
Ouais, c'est bon.
Very moving indeed.
It is, yeah. And the CAR-T therapy used in this clinical trial became the first CAR-T approved in 2017 for pediatric and young cancer patients with a specific type of leukemia. This is the Kymriah from Novartis. Since then, 4 other CAR-T have been approved for blood-related cancer. In 2017, Yescarta from Kite Gilead. In 2020, Tecartus, also from Kite Gilead. And in 2021, Breyanzi from BMS. And just over a week ago, Abecma from BMS Bluebird Bio. If we look at the broader ATMP field, just over 20 products have been approved. In terms of research, solid cancer, including the most common cancer, such as lung cancer, breast cancer, or pancreatic cancer, is the next frontier. Cancer is today the second cause of death globally.
So if I understand well, these therapies are very promising, but available to a limited number of patients today. Why is that, and what are the trends?
So today, this is an area under development where most products are in clinical trials. The few products that are commercialized are still costly. As an example, an autologous CAR-T therapy treatment, like the ones I mentioned before, is around $400,000 per patient. But bear in mind, we are just at the beginning. Treatment cost will decrease. Innovative reimbursement schemes are being developed, and data is starting to show cost effectiveness of a one-time treatment compared to lengthy, more traditional options.
Okay. And you said at the beginning, manufacturing such therapies is very complex. So what's the cost associated to QC in particular?
Yeah, so manufacturing cost of a CAR-T autologous treatment is between $100,000 and $150,000, and QC represent approximately 25% of the cost. So manufacturing ATMP represent a unique set of economic and manufacturing challenges, and QC plays a critical role here.
Okay, but what is the role of QC in ATMP exactly?
So stringent quality controls are required from starting material to final product. The manufacturing process of ATMP is very complex, and products have to be released in a short time frame. These are high-value products that need to be quality controlled with advanced testing solutions for safety and for cellular quality attributes. Time to results and automations are critical. Traditional methods are not well suited to address the specific challenges of ATMP manufacturers. So a comprehensive set of value-added QC, rapid and automated method is needed to ensure that any cell or gene therapy that is administered to a patient is safe, effective, and meet a predefined set of quality parameters.
Well, so QC really is the central point here. I'm now turning towards Felix. Felix, how does the bioMérieux portfolio of solutions meet these requirements?
So we have a very solid set of solutions addressing the safety testing, including sterility, mycoplasma, and endotoxins. So we also have solutions for environmental monitoring. So the bioMérieux offering is currently perceived by customers as the best in class. Today, for example, the bague alert is the gold standard for safety, for rapid sterility testing, and is used by most of the key players in this field. However, reducing time to results is a must to ensure treatment is rapidly available for patients, but also to improve manufacturing and scale-up of those therapies. So the next video, recently released by Novartis, features bague alert. has a key element for the QC testing of cell and gene therapy products.